Hi guys, this is Dr. Pritesh Singh, your NEET SS surgery faculty. And with me is Dr. Hema Kumar, who secured 12th rank in this NEET SS surgery 2023 exam. So Hema, congratulations for this wonderful achievement. Tell us something about yourself.
Thank you, sir. Thank you so much, sir. This is Dr. Hema Kumar. Recently, I have cleared my NEET SS with an All India rank of 12. I studied my undergraduate from Stanley Medical College, Chennai. I'm basically from Chennai and did my PG from Vellore Medical College. I passed out in the year 2020, but I had to do 2 years of bond. So I have been doing my 2 years of bond and simultaneously I have been preparing for my NEET SS. So
Okay.
this year I have been able to crack it.
Right. So you started your preparation during your post-graduation only, or during your
No, sir.
post-graduation focusing on university exam after you started your preparation?
Yes, sir. I
So,
had completing my postgraduate. I had to settle down. I got married and I had
okay.
a and on the way, so I couldn't prepare for the next 1 or 2 years. I prepared for 1 year, sir. From
Okay.
2020 2023. I prepared for 1 year sincerely.
So one big problem during this preparation is that three books are there mainly which we have to study. One is Bailey, one is Subiston, one is Schwartz. Which book you preferred most out of these three?
Sir, I had to go through thoroughly Bailey and Sebastian, sir.
Okay.
And Scots, I had to read vascular surgery. I had to
Okay.
give vascular surgery and the images and tables from Shots. Those were really helpful.
Right. So how to concise the content from first read, because the content is so vast from these books. So how to concise it?
Sir, to concise it, the pattern of questions has been changed from the previous year. Previous year, there were only fact-based questions. This
Right.
year, they have concentrated more on clinical-based questions. So, in-depth reading has been the takeaway point from this examination. So,
Right.
the exam, except for some questions from the vascular surgery, most of the other questions were from Sebastian, but line by line, they had taken the questions from Sebastian, sir.
Right. Right. Now, what's the role of bookmark questions? Like in Prep app, there are questions which you have already bookmarked. So what's the role of bookmark questions? How much time you took for the revision?
Sir, I started revising 2 months before the exam, sir.
Okay.
I made around some 4 to 5 times. I had to revise the notes which I had taken from the video lectures
Okay.
because they constitute the majority of the repeat questions or the basic core concepts which
Right.
were really helpful.
Right. So how many times you revised? Only once or more than once?
5 times, 5 times.
Five times you revised. Okay. That was really great. Really great. And what was the role of treasures? Because in Prep app, there is treasure. So how helpful was the treasures in the
So,
preparation?
regarding Prep app, I would like to congratulate Prep app for giving the mock tests. Those mock tests which had mainly clinical scenarios. No other platforms did give this much clinical scenario based questions. It
Right.
was only PrepLadder which gave so many clinical scenario based questions, and the questions were also so long, which was similar cases. So the time management also was we were able to adapt the time because giving PrepLadder test. But compared to other platforms which we could finish in 1.5 hours or 1 hour also, but PrepLadder mock exams, it took 2.5 hours to 3 hours completely, sir.
Right.
So it was similar to NEET SS pattern. The
What was
mock
your
exam,
last day strategy? Suppose tomorrow is the exam, so one day before, what did you do? Because lots of students are in stress, so much of anxiety.
last day strategies, I had previously collected the tables and important points from all the three books, which I could even share with the other students.
Okay.
So I just revised the images and the tables and the important points, sir. That was the
Right.
last day.
So which branch are you going to opt in this particular counseling?
I'm planning to take surgical oncology, sir.
Surgical oncology. That's really great. So lots of aspirants will be watching this video. So what is your message for the aspirants who are going to appear for the exam?
Those who are doing their postgraduate, it's better to start during their post-graduation day rather than to wait till completing the post-graduation and starting after post-graduation because that is difficult. Once you're near post-graduation, you get a lot of time. So when you have a lot of time, you can read the
Exactly.
textbook. But once you finish post-graduation, you are under the pressure to work, earn for your family, or family settlement commitment issues will be there. So that time it will be difficult to read the textbooks, sir. So that
Right.
was hard for me to read the textbooks. So when you
Exactly.
get to graduation, start reading the textbooks. Each line will be important, and you try to frame questions out of each line. You
Right.
make the scenarios as questions, so that will be very helpful. And make a note of whatever you are learning, sir, and keep revising those notes again and again before giving a mock test or a grant test. That
Right.
will help you get a better rank.
So thanks, Hema. It was really very good interactive session. And I hope that students are going to, learn a lot of from this interview. All the best since you're married also. Now the new aspect of your life is going to begin. So best of luck from the whole PrepLadder family.
Thank you, sir. Thank you.